More broadly, the overall legislative process and where it goes from here. We are joined by Congressman Anthony Weiner from here in New York, and a man who knows a ton about this subject. I'm not sure if a ton is a technical term, Anthony, but you certainly know it. That was my microphone falling on the floor. We'll pick it up after.
I'll just cover for you, Dylan.
No, it happened. The good news is it will not require any health care attention because I didn't hurt myself. Where does the House go from here? In other words, let's set reconciliation aside for a second. You look at the House bill, you look at the Senate bill, where are they most dissimilar? Where are they most dissimilar and likely to be reconciled? Where are they most dissimilar and the hardest to reconcile?
Well, you know, the toughest problem that we have here is that many of the conservative Democrats who keep talking about health care savings, frankly, should agree with those of us who are progressives and say we want the public option. What's troubling here is I see on television Joe Lieberman say, well, I want more cost savings, but I'm opposed to the public option, one of the tools to get the cost savings. The first thing we have to figure out is what it is that some of these moderate voices in the Democratic Party really want. Is it really that they want more savings because we can try to do that? Is it really that they want health care at all? You know, your intro at the beginning is exactly right. The Republicans are not even the issue right now. I mean, I have this website, countdowntohealthcare.com, and the emails were focused on Republicans at the beginning. Now they're on Democrats and saying, why can't Democrats deliver what is one of our basic promises in a way that makes sense? And my friends on the Senate side overwhelmingly want this, except a handful. Want reform, want a strong public option, want cost savings, want the insurance companies broken up. That's essentially what the commonality is. And I got one other question. Where did this number 60 take on so much resonance? All we're asking is let the Senate consider these issues one by one. If Joe Lieberman carries the day, so be it. But if he doesn't, he shouldn't stop everyone else from voting on it.
If you were to look at, if I was to put you in the negotiating room and go down the list, right? Public option, I've got the abortion funding issue inside of the exchange, which you and I have discussed at length. That's kind of, honestly, that strikes me as the more you learn about that one, the sillier that one honestly seems. But when you go down that list, and here it is, public option, abortion, how do you pay for it? All you know the list's better than anybody. This is our version of it right today. How do you begin to try to create?
Well, it's a good question. Some of these things are connected. As I said, the cost savings and having the public option, I think, are really one issue. It's one of the tools to get cost savings. The abortion issue is a puzzling one. If people really don't want to have bureaucrats coming between doctors and their patients, why are we talking about abortion in the context of this bill? Let's put that concept aside. We've got an uneasy peace in this country about it. There's no reason to mess around with it in the context bill. The other things are largely technical. I mean, look, I'm open to listening to ideas from my colleagues about how they want to get to here and there, but it seems to me sometimes that they're taking one or two of these issues and making them a cloak for something else, and that is a lack of coverage and a lack of courage in trying to deal with this problem.
The most common criticism that I hear of any of this debate, I think just pick any of it,
right,
is that the elephant in the room is that it costs too much and we get too little. Okay, and we'll figure out how do you want to do it, right? And that we have what we know is a monopoly system in a business which is predicated on making money by charging to cover your health care and then trying to pay as little for your health care down the line, as opposed to competing to give you good health care. If I even give you good health care, you pay me. Now, we can argue whether that's even plausible. But at the end of the day, is it not going to be impossible for Congress to deal with the things they're trying to avoid, like the insurance monopolies, like the employer-based system, all these different things, if you want to cover more people and have it cost less?
Then there's no doubt. But this is a classic example of legislating, of not letting the perfect be the enemy, not letting the perfect be the enemy of the good. But we are reaching a point here that we're starting to lose sight of one of the major things we needed to do here, which was contain costs. I think critics of this bill are right, and frankly, I'm one of them. I think that we're doing too much to try to protect insurance company profits, which make things too expensive. I don't know how we became in Congress protectors of insurance companies, but sometimes some of my colleagues sound that that's what they're trying to do. But there are ways that we can get both. You know, the public option is something that gets us some cost containment, although not as broadly as you and I would like, because we'd like everyone to be able to get the public option. It has some cost containment, and yet it seems like those are the things that some of my colleagues are most concerned about. If we had an intellectually honest conversation here and we said, okay, cost savings is what you want, I can sit down with Senator Landrieu, Senator Lieberman, Senator Lincoln, and I can say, here's 5 ways we can get cost containment if you really want it. If you want to protect insurance company profits, it's very hard to do both. There's no doubt about it.
But don't you think at the very least in the modern era, information is so widely available. The conversation, and it's so granular. You're able to pick up all these little things that people never were able to carry around with them before unless they were in the health industry or in the government in some fashion. How will it be possible for politicians to basically protect inefficiencies that benefit any special interest and keep their jobs?
Well, look at the evolution of the public option as you and I have talked about over the last couple of months. First, it's this interesting idea, then it's dead. How did it die? It died because the health insurance industry said, we're not going to let Congress move on it. And then the public started to look at it themselves. I got over 100,000 sign-ups at countdowntohealthcare.com. We started to have the public get way ahead of Congress on saying, we want this. That is our salvation here. If the American people say in this end game to the president, to the conferees, to those recalcitrant senators, we want something as simple as the public option to try to do something on cost containment, it's going to live again. I mean, it really is like a Shakespeare play that it's like the specter off at the side coming in every so often, but it's because the American people now have access to the information. They understand it. This is not an issue that the American people don't get.
And as more information is spread, legislators who protect inefficiencies for special interests will be more vulnerable.
That's exactly right.
Yeah,
that's exactly right.
It's a pleasure to talk to you as always.
Thank you.
All right, have a good one.
You pick up all your gear?
I managed to grab it. I didn't injure myself. I don't need any help. I'll be all right. We're okay. All right. Thank you, Congressman. Next.